Hi, this is Dr. Tammy Hayward. I'm coming to you from my home during the COVID crisis to try and talk to you about how to help our kids and ourselves as parents get through some of the challenges that we might face and what some of our kiddos might be feeling or the behaviors that they might be displaying as they struggle with this. But the first thing I want to do is talk to you as parents. All of us as parents are facing increased stress right now. That stress may be that we're home more than usual, spending more time with our kids as usual, being asked to do things with them such as schooling or dealing with them during the day that we're not used to anymore. Even if that's not the case, we're dealing with some lack of social interaction on our parts. We are not interacting with our family and friends and coworkers as much as we usually do. We may be dealing with insecurities about job or financial strains, and all of those stresses are going to come through when we parent. And that is not a criticism, that's just a fact. We're all doing the best we can through this. We're doing the best we can every day. We as pediatricians know that parents want to do what's best for their kids all the time, every day. And you're being asked to be on all the time, every day right now. And I would ask you to give yourself a little bit of grace. Nobody's the perfect parent. We're all going to make mistakes. We're all going to have good days and bad days right now. If you're really struggling, I would encourage you to reach out to family, to friends, to your pediatrician. And if you think that you need more help than that, I'm going to put some resources at the end of this video, some resources that Cook Children's has to help you if you really need help with parenting or managing the stress as a parent that you may be going through right now. Okay, so let's talk about our kids. They all know something's going on. It doesn't matter if you have an infant or a teenager or 10 kids in the ages in between. This is not a normal time for them, and they're going to deal with it in different ways. And what I'm going to tell you are some generalizations. You know your child better than anybody else, so you'll have to take these things as they apply to them, and some probably will and some may not. Our infants are going to be the children that handle this the easiest, but even they are going to pick up on potentially a change in routine or the stresses going on. So what can we do for our babies who are dealing with this? Keep to a routine. Their sleep schedule, their feeding schedule, even if that schedule changes, establish a new schedule. How rigid that schedule is depends on your family, but all children need to know to some degree what to expect. You're going to notice a theme of that as we talk about our different ages of kids. The other thing I'll say about babies is they are innately tuned into our stress levels. When our heart rate goes up, when our anxiety goes up, they sense it and they tend to get fussier. So if you find that you're having a really rough time, put your baby down, take a 5-minute break. It's okay if they cry for 5 minutes. I'm not saying they need to. I'm not saying they learn from that. But if you're struggling to calm them, try calming yourself first. The other thing is that you can cuddle them as much as you need to right now. If you find that being with your baby decreases your stress level, then be with your baby. We're going to have some bad habits to break when all of this is over, whether it's increased screen time with our older ones or maybe holding our little ones too much. That's okay. We'll deal with that when the time comes. Our toddlers may be confused if they're home more than they used to be. They may be really confused if you're needing to work from home. Toddlers are very egocentric, meaning they think the world revolves around them. So if they're home and you're home, obviously you should be paying them attention all the time. And if you're not, they're probably going to behave in ways to try and get your attention. A lot of times this means acting out. It's much more likely that you're going to pay them attention if they throw the remote at the TV than if they build an amazing tower with Legos. This is why we as pediatricians talk about ignoring bad behavior. So I would encourage you, when possible, to ignore that bad behavior. If Junior is, say, licking the window, it's not because the window tastes good. It's because you're probably going to respond to it and come over and give him some attention to try and get him to stop. If, however, you ignore that and when he stops, you come over and say, "Hey, how are you doing? Would you like to spend 5 minutes playing?" Then you've stated that licking the window is not what you want to do, and he gets a reward when he stops doing it. We can't ignore things that are destructive, though. Timeout is effective for hitting, kicking, biting, throwing things at people, whatever the rules are you set at your house, but be consistent. If your toddler doesn't know what to expect, you're going to find them acting out more to test and find out what those expectations are. You might find that your toddler is more clingy. If there's a lot of stress in the house, some children are going to react by fussing and needing held more. You have to deal with this however you can at your house. I would encourage you to give them that extra hug and attention as they need it, but knowing that that doesn't mean that you have to stop doing whatever you're doing all the time. Toddlers are also most definitely going to try and fight the routine of meals and naps if you're home all the time and their schedule's thrown off. They desperately need this routine. All of us have had a toddler skip their nap and paid the price later. Plan to keep to that structure even if it seems really difficult at the time. Our preschool children, those kids aged 3 to 5, are going to have the same issues as toddlers as far as being confused while you're home and not playing with them. But they're also going to have some understanding of what's going on that may manifest itself with fears or anxiety. Try to protect children this age and up from the constant media barrage of information that we're getting. Kids this age do not need to hear about how dangerous this virus is, how many people it's infecting. They will understand even things that we may not think they will. Encourage them to communicate their emotions. Some kiddos aged 3 to 5 can just sit down and talk about this, but most can't. We may need to talk about how their stuffed animals or superhero figures or ponies are feeling about being home all the time or missing their friends. We may need to read stories that are actually written about being sick or being home. But if we don't have those stories, it's okay. We can take any book and turn the pages and tell them a story that we want to give them. Maybe don't pick their favorite book because you might get yelled at if the words are wrong, but hopefully you can pull up something they're not familiar with and substitute any words that you need to. Kids this age have an incredibly short attention span, and it's going to make it really difficult if you have to work from home. They're not trying to be intrusive. They just literally don't focus on things for more than 5 to 10 minutes at the most at a time. I would go into each day with a long list of potential activities and have something on hand to suggest that they do frequently. They're also going to be tempted by screens and foods if they're home with a lack of structure and routine. We're going to give into this some, but try to be cognizant that that's what we're doing. Again, we're going to develop bad habits during this potentially, and we're going to have to backtrack later. Our school-age children are going to have a varying degree of understanding, both between different children and different ages. Try to explain to them in reassuring, age-appropriate terms what's going on, while protecting them, again, from that media barrage of information that is not going to be helpful for them to hear. These kids want to please you. I would ask you to remember that, because sometimes they're going to fail when they're trying to do that. But when you ask, hey, don't interrupt me, and they do, they're going to feel bad about it afterwards. So while we want to, on one hand, structure their behavior, keep them engaged, and know that we need to potentially work from home or need time to ourselves, we also want to temper how we react to them, because they will feel guilty when they don't do what we want them to do. Again, have a long list of activities to potentially entertain them. Sometimes the ways we get kids this age to talk about what's going on is to share ourselves. One of my favorite things to do is when we're having a meal together, and hopefully we're having meals together right now, is to go around the table and have everybody share whatever we need to talk about with that particular kiddo. So if somebody's feeling, you think they're feeling sad or scared, everybody shares one thing that worried me today. If someone has a really negative attitude, everybody, including parents, shares one thing that I did that was really good today or really fun. or how did I change the world today, or whatever it is. But when we share, it encourages them to share and gives them permission, and also sort of takes away the permission to not participate. Also, maybe your child will need some cuddle time to talk with you one-on-one. With everything going on right now, right before bed may not be the best time to talk about the scary things out there in the world. You might need to make some time and space, read a story, give them some time to talk to you without a TV or anything else on. That's just some time to communicate in a safe space. These kiddos are also potentially feeling the effects of social isolation. They are used to going to school and interacting with friends and other people every day. Maybe think about having video dates with friends, maybe thinking about writing letters to people. These kids have a lot of energy. They need to be able to get outside and play, or stay inside and have some physical activity. They also need structure. Consider a schedule written down for these kids. They're going to get tired of us telling them what to do all the time. They've been tired of that for years, let's be honest. So if we can point to a schedule that says, oh, look, we agreed that right now it's time for you to do your chores, that is often more helpful than me as mom saying, it's time for you to do your chores. I would encourage you to consider including in that schedule meals, snacks, exercise, time for learning, time for chores, free time, and sleep time. Get your kids to help you with this schedule and talk about what should be included in it. Again, a 5-year-old will have much less input than a 10-year-old, potentially, depending on the child. But they'll all have something to say about it, and often it's surprising how valid their contributions are. And then our teenagers. These are our children who are going to be most affected by these times. They're going to be feeling the social isolation the most. Typically by this age, the center of their world has shifted from home to their friends. And we really need to consider how we help them through this. Talk with them about what your media policy and social media policy and screen time rules have been. They may need to be changed. We still want to keep our children safe while they're participating in social media, and we don't want them on their phones and computers and devices 24/7. But talk with them about what those rules are. They really may become anxious or depressed as they think about how this is impacting their world. There may be fears about infection of themselves, friends, family members. There may be fears about how this is impacting their learning. Are they going to pass their classes? Are they going to move on to the next grade? For our older teenagers, has this affected college testing or applications to colleges or AP tests? Some really valid concerns that we want to discuss with them and help them understand, but also not dwell on. Help them realize that everybody knows that these things are issues, and while we don't have a solution today, we all know that there needs to be a solution, and that we're on their side and their school is on their side to help them through this. They also really may need encouragement to participate in healthy activities. Think about a schedule for them. Talk with them, and they will be the ones who are probably enforcing the schedule for the most part. But we really, as parents, need to make sure that they're getting exercise, that they're getting sunlight, that they're getting out of their rooms, that they're eating meals on a schedule, and that they're sleeping. Our teens and all of our children may feel very helpless or frustrated at this. Counterintuitively, perhaps giving them extra responsibilities in the house may help them. Cooking dinner may help them feel like they're contributing to the family, or watching a younger sibling, or building something. I don't know. You have to think about what works at your house, but we all like the feeling of accomplishing a job well done. And that may be something that we can do to help our teens through this. And I always encourage to point out the privileges that come along with the responsibility. And again, you may need to brainstorm or really think about this as a family. But for example, if cooking dinner is the responsibility, then maybe picking some of what you have for dinner, or not having to clean up, or extra screen time. I don't know, but to link that to something that seems rewarding, even though we as parents know that cooking the dinner in and of itself may be the reward. So I think that's it for this